All right, I am thrilled that we have such a wonderful turnout from our community. Anything really wonderful that we accomplish as a community happens because a lot of us come together and pull in the same direction. And so let me just start the announcements we're about to make today by saying thank you to all of you who've been here or who have taken the time to come out this morning and celebrate with us. But this is a true community project. It's one that took a lot of people, and we're going to introduce a few of those here today. But I want to say thank you. We have, we've leaned on our elected officials. I want to say thanks to Mayor Lorenz, who's been a real partner with us down here in Belpre over the course of this entire development, and this is just yet another step in along that path. But Mayor Schlicker up in Marietta has been helpful with so many of our projects, and of course our county commissioners. I saw several of them. I know I saw Charlie and Kevin. I'm probably missing if I have all of our county commissioners here, but it is truly a team of people that make this happen. And so thank you all for being here to be a part of this. Let me also say thank you to our boards. I see, the Memorial Health System has an amazing group of leaders. First on the hospital board itself that gave us vision, gave us opportunity to do this. So thank you to the hospital board members that have supported this vision, and our foundation board, who is really instrumental in helping us find the sources of funds to really make this happen. And so we're going to talk a little bit about that here this morning as well. And certainly I would be remiss not to talk about the doctors and the employees, the 3,500 physicians and employees of the Memorial Health System that really bring a commitment of world-class healthcare to life every single day. And so the ability to inspire this community and bring services like this to this community is really on the backs of the hard work of people that just love this community and want to provide great healthcare. And so that's what really today's all about. So I get the privilege to announce maybe the worst kept secret in town. And I know everyone's on pins and needles wondering why we called this press conference here today. But we are here today to talk about the next major investment in this community, something that hasn't been done ever before, and that is the announcement of the building of a women's and children's hospital right here on this campus, immediately to our left. We have been blessed to make a lot of investments in this community and are making those right now. For example, in Athens right now, we're mid-build of a campus that looks a lot like this in terms of the services it provides, a little over $100 million that we're building in Athens. And I tell you that to say, for rural hospitals, rural healthcare, we have to do things a little differently. This isn't the Beltway of Columbus, and so we have to think a little differently. We think about our region and how to build services across a broader region to have that population base that really makes things like a women's and children's hospital possible. And so I'm really appreciative of the team that we have from Athens that are really helping us build out that part of our region. And that's how I think about the Mid-Ohio Valley, is we can serve a population that it spans from halfway to Charleston, halfway to Columbus, halfway to Wheeling. That's kind of us. That's who we serve, and that's who this Women's and Children's Campus is going to change the quality of life for a lot of families that have taken for granted that a 2-hour drive to Akron or a 2-hour drive to Columbus was just part of what it was to live in the Mid-Ohio Valley. And we're going to change that with your all's help today. So I am thrilled to talk about that. And of course, first and foremost, before we build the inpatient hospital, we're going to open a pediatric ER. And so right behind me, that's been built. And I hope that you're able to stay here at the conclusion of this and maybe take a tour of that pediatric ER. We often lead with emergency services because that's how the community often experiences healthcare. You first experience an emergent event, And from that emergent event, you have all the follow-up care. And so we wanted to lead, as we always do, with great emergency care. And so that was the very first part of this project, and we've already moved ahead and partnered with Akron, and you're going to get to meet some of the folks that are going to actually be seeing the kids in that emergency department today. I would say that growth like this requires an incredible amount of funding support. The Memorial Health System needs partners, and so a lot of what we're going to do today is highlight for you how we put this together. But I will tell you that it's a combination. Certainly, we're going to highlight some of the donations, and we're going to start today with really kicking off the fundraising drive in support of this. But I would also say, as we build this coalition, the first place we turned to was Akron Children's, our partner for a lot of pediatric care in this region. Over the last several years, we've grown that partnership, and it's been really a wonderful addition to the specialty care services for kids in our region. And so Akron has agreed to put a significant portion of the $125 million necessary of their money into this project. Of course, Memorial Health will match that level of contribution ourselves. And then we'll turn to our foundation and ask for support from both the government and from the citizens in this community, people like myself and others that really care about wanting to build children's health care. And together we will meet this challenge of $125 million, I can assure you. And we got to that point because we've seen the level of commitment, we've seen the partnerships really grow. But like I said, let me get us started, and I want to introduce to you first today, because we always lead with emergency services, and it's been kind of the backbone of our health system. It is my privilege and pleasure to introduce to you all Dr. Brian Scharfenberg, the director of our emergency service line. So, thank you, Dr. Scharfenberg.
Hi, again, I'm Brian Scharfenberg. Welcome to all of you. I'm very excited to see all of you here. I'm speaking to you today not only as a physician, really, but as a community member and parent. In fact, the parent of at least one fairly accident-prone child. And what I want to say is, where we're standing, this pediatric emergency department really represents a foundation and a cornerstone for a new era in healthcare in this region. And for me personally, I just want to take a moment. We're going to thank a lot of people today, but I personally want to take a moment to thank Mr. Cantley, because look, this doesn't happen without visionary leadership. And I would like to thank Mr. Cantley for that leadership. So this department, and again, I hope you'll take an opportunity to walk through it. Really, what this represents is a purpose-built facility that's designed to care for children. It would be wonderful if we lived in a world where children didn't get sick or injured, but obviously we all know that's not the case. And those episodes of illness and injury can be some of the most stressful events in the course of a child's life. And really, this facility allows us, with the partnership of Akron Children's Hospital, to provide not only the state-of-the-art in terms of clinical excellence for those children and their special needs, but also provides the whole experience, the best possible experience that we can possibly give those children. And I think you'll see that is evident in the details of this space. So please do come over and check it out. I know there's a lot of speakers today, so I'm going to be very short. Thank you again for coming. Welcome. I'm excited that you're here. And without further ado, I'd like to introduce Dr. Renee Kaslow. Dr. Kaslow is a pediatrician, and she's also the Executive Director of Physician Services here at Memorial Health System. So, thank you.
Thank you, Dr. Scharfenberg. Today is just amazing. This is an amazing, amazing day. And I've been excited. As much as I don't love public speaking, I have been so excited this week to stand right here and to be able to talk about the journey we're about to embark on. I have been a pediatrician now in the Mid-Ohio Valley for about 12 years. I have always been proud of the care that we have provided. Always been proud. Our nursery is top-notch. Our preventative care is top-notch. We do an incredible job. But today, we're raising the bar. Today, we're leveling the playing field. Our urban counterparts, they always have access to the tertiary pediatric hospital. But now, we're going to even that playing field. So our children, our young adults, our adolescents, they're going to be able to experience the same care that their urban counterparts have. This is huge. The children that we have to send 2 hours away to get that world-class care, they're going to be able to get it here. And we're building the foundation so that more and more of those services can be obtained here. Newborns in the nursery, they won't need to be transferred. They'll be able to stay and receive the care and stay with their mothers. The importance of bonding with their mother and being able to receive that care right here on this campus, today is an amazing day. It is the beginning of something truly amazing. And I can't even put real words together about how excited I am to start this journey with everyone. So I want to thank you all for coming today. I want to thank you for all being a part of this. It's with your help, your support, your investment in our community that we're able to move forward with this. So thank all of you. And now we get to invite some of our friends from Akron up to the microphone, and I would like to introduce Dr. Shefali Mahesh.
Well, good morning. My name is Shefali Mahesh. I am the Dr. Noah Miller Endowed Chair of Pediatric Medicine at Akron Children's Hospital. And it is my absolute honor and privilege to be here today on behalf of Akron Children's to make this announcement about this significant project that is going to help so many and serve so many people in Southeast Ohio. Akron Children's is a freestanding, independent pediatric healthcare delivery system. And we focus on one thing, and that is kids. From newborns to college age, that's all we think about, that's what we're devoted towards. And one of our strengths is taking care close to the community, bringing care as local as possible. We can't do that alone. We do that in partnership and in collaboration with our regional health partners. So we are so excited to further our relationship with Memorial Health Systems and take this to the next level, and as Dr. Caswell said, raise the bar of pediatric healthcare in this community. With that, I would like to introduce Dr. Brett Luxmore, who is going to be the medical director of the Akron Children's Emergency Room on the Belpre Medical Campus.
Hi, Dr. Luxmore. I'm just so inspired by what's happening here, and I'm very excited to be asked to be part of this. I've been working in peds emergency medicine for 20 years. I have received my medical school education in Athens at University of Akron. So this is going to be great. It's going to be great. One of the things that we're going to be able to offer some services here, including our psych intake. So with the increasing of mental health emergencies in kids, it's something that can be offered here with telemedicine and delivering appropriate resources to kids. So hopefully that'll help significantly, and also taking some of the burden that adult EDRs have of seeing children that can be complicating, requiring some specialty care, and also working with their parents and families. So we're all excited to start working. I'm going to introduce the next speaker, Jared Stahl, Executive Director of the Memorial Health Foundation.
Thank you, Dr. Luxberg. This morning is a very special morning for all of us here in this community. And On behalf of Memorial Health Foundation, I want to extend our welcome and thanks for you being here, as well as want to recognize and acknowledge the Foundation's benefactors that have joined me both here on stage and in our audience this morning. It is truly only your philanthropy that helps us continue to enhance healthcare for our community. And as we get ready to hear from some of our benefactors this morning, I think, Mr. Cantley, maybe it's a good time to reveal what this building is going to look like. There's some divine intervention, I think, telling us that everyone wants to see it. So, Dr. Kaslow, Dr. Scharfenberg, if you want to join Mr. Cantley. All right, 1, 2, 3. So as we look at this facility and think about it being right over here where this gray building is going to be, I think we can start to envision just the impact physically it's going to have for our area, but also for the care, what that means for the care of children and women throughout our region. And as we've learned this morning, it's really a very special day for all of us who live and work in Southeast Ohio and the counties that surround us around West Virginia. And as Mr. Cantley very rightly emphasized earlier, in order for us to achieve our vision of developing a women's and children's hospital with unprecedented services that aren't currently void in this area, we need the collective efforts of everyone here and beyond to do this. It is through our united commitment that we will be able to transform healthcare in the Mid-Ohio Valley. This moment is really reminiscent of a time in the 1920s when Marietta Memorial Hospital was being conceived. And today, we're right there at the beginning of a true healthcare transformation for women and children in our area. Joining me on stage are representatives from 2 leading businesses in our community and a very prominent family. All remarkable community leaders. Their presence here today signifies their shared passion that we have with the health system for improving the health of our community. Hall Financial Advisors, representatives from the Dave and Arlene Archer family, and People's Bank are exceptional partners in our journey toward fostering a healthier community. Each of these organizations truly understand the significance of having world-class healthcare facilities in close proximity to where we live and work. And I know each want to share from their unique perspectives the importance of having accessible, top-tier healthcare for our community. And so it is my pleasure to first welcome Chris Hall, founding partner and CEO of Hall Financial Advisors, to the podium.
Well, thank you, Jarrett. Thank you for allowing me to speak in front of you today, and it's quite remarkable to understand the undertaking and the vision that Scott, the trustees, and those around us that have, and to see us execute on that is evidenced by the Pediatric Emergency Department that they were speaking of earlier. And if you get a chance to go through there, I would highly encourage you to take advantage of it because it's extremely inspiring. Beyond that, to my left is going to be the new Women and Children's Hospital. And when we were approached by this terrific organization, we thought, what better way to align our corporate values than focusing on the women and children of the Mid-Ohio Valley. Now, I speak today on behalf of my wife, Kimberly, my business partners, Jeremiah, his wife, Lindsay, my business partner, Brett and Leslie, my business partner, Rob Blazik, and his wife, Amber. Now, this business of ours started from nothing in 1999, and today we have the privilege of serving nearly 3,000 families in the Mid-Ohio Valley and managing roughly $1.4 billion of folks just like you. When given the opportunity to give back in such a big way, the answer was yes, Scott. How can we help? How can we partner with you to further align our goals with your goals? And in all those years of doing this, I can tell you that we all have 4 things in common, and they're all in different order for everybody, but it's your family, your faith, your health, and your finances. I obviously have expertise in finances, but now I get to align myself with 2 of the most important things that I have found everybody has in common. So with that today, we've made the commitment of $1 million to the $1 million is hiding behind a check, or hiding behind it. So thank you. Yes. And so the $1 million is a commitment that my wife and I made personally, but certainly is not possible without the business partners that we have as well. They've made a huge commitment, and our organization has established our own giving foundation. And just to be brief about that, the most important thing about our giving foundation, it's 100% funded by our organization. We do not take any outside funds. And every month when we receive our paycheck, the very first deposit that we make is into our giving foundation. So of the 23 people that do work for us, everybody that's pushing buttons, pushing paper, making phone calls, they are represented in that $1 million as well. As it was alluded to earlier, the funding of these projects are critically important to this area. For people like us, we do have the ability to go to Columbus or Cleveland for special needs, but the vast majority of the people in this community do not. So we're very grateful to be partnered with the Meriden Memorial Health System along with Akron Children's to help develop the Women and Children's Hospital. And I would ask each of you to think deeply, like I did, and it gets a little uncomfortable at times when you make a gift of this size. But the gift today is a legacy that lasts forever. And if you think of the number of women and children that would be impacted by that uncomfortable gift I'm challenging you to think about, it is quite rewarding. So we're tremendously grateful to have the opportunity to be here, to have the opportunity to make such a donation, and couldn't be more proud to be deeper rooted in this community in the Mid-Ohio Valley. So with that, thank you very much, and I would like to introduce Mike and Mrs. Arlene Archer on behalf of their family and their foundation.
So, wow, what a great day for the Mid-Ohio Valley. The first thing I want to say is my dad, Dave, couldn't be here today. He's actually woke up, he was feeling under the weather, but nothing serious. He was just, I think he had a fever this morning, and so he sends his regrets for not being here. But I guess I'll start with, when Scott first brought this project to the board, 2 things came to my mind. The first was, if this happens, what a game changer for Southeast Ohio. It would truly be a game changer. But then the second thought was, this is going to be a heavy, heavy lift. It's going to take a lot of people, financially, government officials, people making calls, a lot of support for this project to happen. And the fact that we're standing here today is really overwhelming. It is such a great thing for the future of this region. Now, I'm going to tell this story because I've told it to the board before, and so some of you in the room have heard this before. But this story really makes it hit home to me what this hospital is going to bring to the kids of this region. So I have a son, Graham. He's about 7 years old, and there's some people like Colleen in the room that know Graham. Stephanie knows Graham too. And he's a really ornery little guy. He's kind of like his grandpa, if you know my dad. But when he was 2, he was having breathing problems. And so we did like every other family. We brought him down here to the ER. Now, it turns out he just has asthma. You know, a lot of kids have asthma. He takes his inhaler when he gets sick. But at the time, you don't know that. And so here's this 2-year-old. He doesn't understand what's going on. He gets an IV put in him. He's got a mask over his face. He gets put in an ambulance, gets taken 2 hours to Columbus. We end up staying up there for 5 days, okay? And I bring that story up because I'm blessed in that when that occurred, I had a daughter at Fort Fry. I had a sister that lives a minute from me. She took care of Hannah, my daughter. My mom and dad took care of the business interests and the companies. So I'm blessed. But why that hits home to me is I think about the single mom. Maybe she's working an hourly job and she's got a 2-year-old. She has someone in middle school. She's got a high school. And her whole life is uprooted by having to travel 2-3 hours away, stay up there for 4 or 5 days. How's she going to pay the bills? Who's going to take care of her kids? And this project, for those kind of stories, it's life-changing. It truly is a life-changing project. And that's why I'm so proud to be part of that and also on the board. In addition to that, I will tell you that we have a lot of economic development folks in the room. I saw Jesse back there in the back and many others. One of the first things that customers say to us, our customers, our company's customers, when they're just trying to decide where they're going to build their new facilities, is what is the healthcare like? What is the healthcare like? And today, Southeast Ohio is going to be put on par with the big cities. And that is going to create economic development. So we are so proud to be here today, so proud to support this project. And on behalf of my dad, my mother Arlene, and our entire family, today we're pledging $1 million to the building of this facility. So with that, and I'm not going to say his last name because I told him I'd butcher it anyway, but I'm going to introduce a good friend, Chuck, with People's Bank. Chuck?
Thank you. Wow, pretty cool event today, huh? I'm going to mix up the order. I know everybody ended with the checks, but I'm going to let the secret out of the bag. On behalf of the 1,500 employees of People's Bank, we are delighted to announce today that we'll be making a $2.5 million contribution. Now, the cool thing about those checks is there's only one place that they can get deposited, okay? Not bad. I know that people have talked about the facility, and the facility is certainly marvelous, but it's really the care of the professionals that make the special things happen. And to give them the tools to make this community better, to help the kids, to help the women, and to keep the families united and to have quicker recoveries is really such a beautiful thing. And it will help us be more economically competitive. As Mike mentioned, people do ask about healthcare, they do ask about the schools. It is important. So I see this as a big stride forward, and I think our best days are in the future. So we are very humbled at Peoples to be able to make a positive impact in the community. It's an important essence of what it is that we are. We are very grateful to the other donors for their generosity, and look forward to seeing this completed, and thank you all.
Wow, what an impressive day, and it continues. We cannot thank, on behalf of the foundation and the health system, People's Bank, the family of Dave and Arlene Archer, and as well as Hall Financial Advisors enough for what the impact their gifts are going to make on this community. And I know that Mr. Cantley wants to extend his gratitude as well, and so welcome again to the podium, Mr. Scott Cantley.
It just is overwhelming, the care that you have for this community, in addition to wonderful businesses that have been great partners with all of us. Your generosity and your willingness to give back to make this community a better place says so much about each of you and your businesses. So I want to say thank you to all of our donors here today. And I also have the additional privilege to introduce our final speaker and a donor that has really created some incredible momentum for this project. I'm going to introduce Jay Edwards to you. Jay Edwards is our state representative from Athens County. Jay, if you don't know Jay, he grew up in Nelsonville, and I think the reason that I mention that to you is Nelsonville saw the closure of a hospital, and so Jay's lived through what it is to see the destruction of rural health care, how difficult it is to maintain a vibrant community when your hospitals aren't vibrant. And so Jay has been an incredible partner as we began to think about how to build the coalition necessary to make this project happen. Jay has always been a fierce advocate for parity and investment in rural southeastern Ohio. That's been his platform he's run on and maintained those commitments. And today he's able to bring that commitment to life right here in Belpre, Ohio. What he's going to be able to share with you today is the work that we could not have accomplished had it not been for Jay. He recently became the chairman of the Finance Committee for the House of Representatives here in Ohio, and his leadership was critical, absolutely essential to making this happen and bringing this project forward today. And so it is absolutely my pleasure for me to introduce to you this gentleman who, Jay, your legacy for generations to come, I believe will live in this building that we're about to create. And Jay, it is my pleasure to ask you to come to the podium and give your release. Thank you.
Nothing like a politician to get in the way of such a great day. But no, I whenever you speak at these events, usually you're given a script, so I want to apologize in advance, Scott, because I typically don't follow the script. But I just want to say it's a great day to be here in Belpre, Ohio, and I ran for office for the first time in 2016 and started coming down to this area about that time, and there is no place, and I truly mean this, there is no place like Washington County and Belpre, Ohio when it comes to working on issues. It's amazing when you go to some other communities, sometimes politics, sometimes jealousy, sometimes anything can get in the way of trying to help people. When I come to Belpre, Ohio, I realize people put all that to the side, and it is truly a great community to work for. And so I want to say thank you for accepting me, and thank you for making my job easy as it comes to working on issues and changing people's lives in Belpre, Ohio, to all the people here. So how about a round of applause for everybody here? So as Scott mentioned, I did get asked to be the chair of the Finance Committee. I thought I wanted it at one time. There were some periods of time where I wasn't sure I wanted it. It was pretty busy for the last few months, the first 6 months of the year. And usually the chair of the Finance Committee are from other areas of the state. So it was an honor to be from Southeast Ohio, to be named to control basically the state budget and to be able to work on it as it pertained to the House of Representatives. And about a year and a half ago, prior to me being named the finance chair, I met with Scott and his team right here in Belpre to talk about this facility. And they had mentioned trying to get the government to invest in this project. And it was a large amount of money. It made me scratch my head a little bit. But I can tell you that Scott and his team took those ambitions and talked to the governor, Governor DeWine, and others. And I think they were met with a little consternation in some of those meetings. It was kind of an uphill battle of the amount of money that was being asked for. Fortunately, I'm here today to announce that we were able to sign, it's been signed by the governor and signed into law, that the state of Ohio will be investing $30 million into this facility. And so, you know, it was an uphill battle. I can tell you it wasn't easy to fight for, but we were able to get it across the finish line. And a lot of people on the team are to thank for that, because they worked the state, they worked the members of the legislature. There's 132 of them. They talked to all the ones that mattered, but it was still an uphill battle, and we were able to get that done. And I can tell you, just from my short time of being in office, when the state is investing any amount of money, but especially that amount of money, you have to have a worthy partner. And from the city of Belpre and Washington County and Memorial Health Systems, there's obviously a worthy partner. But I'm here to say, and I've told this to Scott privately, this investment, although the check's going to say Memorial Health Systems, is not an investment in Memorial Health Systems. This is an investment into Southeast Ohio. There is no reason why children, women, or families should have to travel to Columbus, to Akron, to Huntington, West Virginia, to get their health care. And that is really the basis and the fight that I took into the legislature and trying to get this money across the finish line and get this $30 million investment. But I'm also here to say it's not just about health care either. There is going to be massive economic development. I see a lot of the school districts here today representing. I see Jesse Roush back here. I see some of Washington State Community College, Washington County Career Center. We've got to get to work to make sure we're getting people to the spot to where we're going to be able to work in this facility. And I can tell you, as I'm traveling around my district in Southeast Ohio, I was in Meigs County a few nights ago. Got a standing ovation talking about this project, because although it is in Washington County and in Belpre, again, this is a regional impact for kids, children, women, and for jobs that's going to be coming to this area that'll last for a very, very long time. So I want to say thank you to everyone that made it possible. Thanks, Scott.
I couldn't be more proud of a team that worked so hard. Jay, it really wouldn't have happened without your work. It is a transformational moment for this community, for this region. And I appreciate the partnerships, Akron Children. I appreciate the partnership, the public-private partnership that has to occur to bring big things to life like this. And most importantly, I appreciate this community that is working so hard to make the community better, and in this regard, we're making healthcare better. We're going to leave a legacy for future generations by the work that we're doing here today. So, thank you all for coming. I want to encourage you to take some time to visit the ER. And once again, let me say, Chris Hall Financial, amazing. What we're celebrating here today is $34.5 million. I call that a great start. And we look forward to breaking ground on this very, very soon. People's Bank has been great. I want to say to the Archer family, not only has a great business with the Pioneer Group, but Mike Archer's my board chair, and Mike probably didn't say that he probably thought we were all crazy when we started down this path. But Mike, it's leadership like yours. Not just as a community leader, but at a board level. Thank you very much for all you've done. Thank you. So, I have some special guests. Maybe the most esteemed guests are about to arrive here. So let me make room for these special guests to come up. I think they have something they collectively want to share with us.
Hi, I'm Mills, and I have the great pleasure of thanking Chairman Edwardson in the state of Ohio for supporting the new Women's and Children's Hospital to support care for children like me.
Hi, my name is Parker, and I want to thank Hall Financial Advisors, People's Bank, and the Archer family. On behalf of all the children in this region, I thank you for donating to the new Women's and Children's Hospital.
Do you all have signs? Do you want to give to the donor?